Well, good afternoon, and thank you for spending a little bit of time with us this afternoon in this edition of Dialogue with the Dean. Before we start, I do just want to remind everyone that throughout the course of the live video presentation that if you have questions that come up, please use the comment function there on Facebook. Post those questions. We'll check back at the end of the presentation and address any of those questions that you might have. Well, today our guest is Dr. Craig Svensson, Dean Emeritus of the Purdue College of Pharmacy, my predecessor in this very office. He's also Professor of Medicinal Chemistry and Molecular Pharmacology, and he is the author of this book, which is entitled, When There Is No Cure, How to Thrive While Living with the Pain and Suffering of Chronic Illness. Craig, welcome back to what was your office.
Thanks for having me.
It was right after you left this office, you took a sabbatical, and the focus of a good portion of that sabbatical was the writing of this book. Why did you write a book on living with chronic illness?
Well, the credit for the idea really goes to my daughter. When I told her well in advance what my plan was, stepping down in July of 2017 as dean, going on a sabbatical and working on a book, she asked me, well, what are you going to write about? I said, well, I'm going to write on the topic of addiction. And she came back to me and said, well, I thought you'd write a book about living with incurable illness. You've been living with several incurable illnesses for years, learned how to do it well, and thought you could have some input to help patients. So I thought about that and thought, made sense. As I went through then and traveled different places in the country, professionally and personally, I'd stop at the bookstores and I'd ask the bookseller, if someone came to you and said they were diagnosed with an incurable illness, what would you recommend for them to read to help them prepare how to live with that? And they always came up with blanks. They had no idea what to recommend. So that said to me that perhaps there was a gap there and maybe it's something I could fill. So I thought more about it, did a little bit more reading, and decided, you know what, this is something, this is a topic that perhaps combining my experience as a patient and my experience as a health professional, I could fill that gap and help patients to learn how to live well in the midst of facing an incurable illness that brings pain and suffering into their life.
So who do you think should read this book and why?
I think there's three groups. First of all, of course, patients that have an incurable illness. Second, those who care about them, the family members and friends, and then health professionals. In terms of patients themselves, it's very important that you live intentionally if you're going to live well when you're facing the reality that the physical foundation of your life is crumbling one brick at a time. And this book will help them think that way. Secondly is for family members and friends, because they're going to be impacted as well by the illness. And they need to understand how that will impact them. For example, there are studies that demonstrate that some patients who are diagnosed with a neurodegenerative disease, their family members experience more depression and anxiety than the patients themselves. And then third, for health professionals, I think it can help them recognize that they need to realize that patients with chronic illness are very different than acute illness. Most of us, until we age, have only experienced acute illnesses. And with an acute illness, we get a fever, we get nausea, we get pain, some degree of suffering, but we think this is going to heal, this is going to pass. But when it moves to an incurable ailment that's going to travel with you for the rest of your life, the locus of suffering moves from the physical to the personhood. Because now that's going to change how I live my life. It may have dashed some of my dreams and hopes and plans. And health professionals need to recognize they're dealing with a very different patient group. We don't historically do very well preparing health professionals for that. So I hope that each of these three would find something in particular for them.
So going a little deeper, what do you hope readers will get out of the book?
For patients, I hope it will help them chart a course for their journey to living well. In the book, I address some of the difficult challenges that patients face that they perhaps would find difficult to find guidance elsewhere. For example, how do you get your doctor to take seriously your complaints? What do you do when your physician responds and says, you know what, I don't know how to help you. I don't know what else we can do. How do you sift through the myriad of health information that's out there and make good choices for yourself? What do you do when you're faced with a variety of therapeutic options, but all of them could cause serious harm? How do you pick which do you do? Many people live with an invisible illness. In fact, The NIH estimates that perhaps 10% of the US population is living with an invisible illness that impairs their life. And often those people will say, one of the hardest things for me is the judgment that I get from others, the things people say and do. How do you deal with that? How do you live with the fear of how your life is going to change by this incurable diagnosis you've received? So I go through these and other areas to help patients think about the myriad of decisions they're going to have to make. For family and friends, it's helping them understand the experience that their loved one is going through, and also how that's going to affect their relationship. I have one chapter that's devoted to just how can you help? What do you say? What do you not say? What things could you do or not do? And then for health professionals, it's interesting as I've talked to patients with illnesses, and if you read the various blogs and read memoirs of patients, it's very clear that a common patient experience is, I feel like they don't understand what I'm going through. They don't treat me as a person. And I hope that what health professionals who read this book will get insight into what it's like to be a patient with an incurable illness and how they can better interact and help patients like that.
It's just so important as we think about the large number of folks who are going through these incurable illnesses and the need to understand those plights and to help them, especially chart that course, as you said, for themselves, and to have the patience sometimes too. That's a big thing, I think, for many folks. Many folks don't know this, but when you launched the book, you came to us and you said, I want to give a portion of the proceeds from this book to support the Rokai Student Scholarships. Very generous gift. Why did you decide to do that?
I've always been impressed with our chapter of Rokai that's been devoted to raising scholarship funds for fellow students. I've admired them so much for that as a priority. My wife Sue and I have supported that throughout my 10 years, Dean, and giving the royalties of this book to that cause just seemed like a very logical way to be able to help support, continue to provide support for that cause.
Well, thank you for continuing to find ways to support students through your scholarship. So I guess the question would be, where can people find the book?
Yeah. It's available at the usual online retailers, Amazon, Barnes & Nobles. It's available as an iBook. If people prefer to provide support for their local independent bookseller, they could go in. It probably won't be on the bookshelf, but their bookseller could order it because it's available through the largest distributor that sells to booksellers.
So I did check out. It is on Amazon, easy to find. You can type in when there is no. If you could just get that much typed in, it'll fill in the rest. But by Craig K. Svensson, it's there, easy to find, and it's a 5-star book. I think the reviews are all 5 stars. So that's congratulations on that. Usually, there's an opportunity for the guest to ask me a question or so. But anything you're wondering?
You know, one of the things that came out as I was researching the book, and particularly talking to patients, is the trouble many of them have in interacting with their health professionals, feeling like they don't empathize with them, they don't sympathize, they don't understand what they're going through. So the logical question is, what are we doing to make sure our graduates are better prepared to handle the interactions that they're going to have with patients living with chronic illness?
I think as a college, we've really taken very seriously the need to not only equip our students with the knowledge around medicine and the pharmacology and physiology and therapeutics and all of the aspects that go into treating and providing patient care, but also helping them to develop in their emotional intelligence or their EQ. And part of that is an empathy. And so we have a course now that Drs. Monica Miller and Ellen Shellhouse teach. That's an elective course, but they're learning a lot about what it means to teach empathy, and that it may sound a little odd to some folks, but we find that you can help students on their journey and their professional development to develop to be more empathetic. And I think that sits really at the core of what we need to do, both within our curriculum, our co-curricular, extracurricular activities as we continue to develop out, so that our student pharmacists, as they're going through their journey here with us and as they go out into the world, are really thinking about what it means to walk in the shoes of the patient. And to your point, it's not just about the treatment, the medical treatment, but it's thinking about holistically who that patient is and what their journey and what they're going through. And that level of empathy is really, really important, I think, for our graduates to really function at the highest level as they try to deliver patient care. So I think we take that very seriously, and so we're finding ways, I think, new and innovative ways to help build emotional intelligence and empathy in our students.
That's great.
Yeah. Well, I'm going to check, are there any questions that have been asked? I see that there have been none. As always, as you watch the video in the coming days, if you have additional questions for myself or Dr. Svensson, please go ahead and you can comment on those. We'll check back from time to time, and if there needs to be a response, we'll try to provide that. As just a final reminder, the book is When There Is No Cure, How to Thrive While Living with the Pain and Suffering of Chronic Illness. You can find it on Amazon. I encourage you to go out and buy the book. Well, again, thank you for watching. We hope to see you again next month. And as thank you to Dr. Svensson for being here. And as always, hail Purdue and boiler up.